All right, I do have 12:01, so I would like to bring this meeting to order. I would like to welcome you all and remind you again that your speakers are probably muted, but don't hesitate to hop on, unmute if you have any questions today. We would love it if you would share your video, then we know who our laboratorians are across the state. But I understand if that's not possible. So I would like to let you know that this meeting is actually being run from central Nebraska. I am coming to you from near Valentine today. Had I been more organized, I would have loved to have run this meeting from the Valentine laboratories. That would have been really fun to do, but I didn't give them enough notice. I'd hate to drop in on them. So I wanted to see who is here from our DHH staff, and I believe I see John. John, you're on, right? Just wanting to make sure.
Yes, I am.
Awesome. Glad you are. See who else is on today. Paul, can you hear me? Are you on today?
I'm here.
Yep, good. I guess you're from the MPHL side, but that's okay. Brianna, can you hear me?
Yep, I can hear you.
Awesome. Thank you for being on. Looking to see who else. And Brian Buss, glad to have you on today. Can you hear me?
Yeah. Hi, Karen. I'm on.
Awesome.
And I want to introduce Lauren Jansen, who's new to our staff. She's Epidemic Intelligence Service Fellow assigned here from CDC. So she just started with us a few weeks ago. So Lauren is on today too.
Awesome. Very nice to know. Lauren, thank you for joining us today. Really good to have you too. And Lauren will be with us for a year.
2 years. You can give a little introduction too, Lauren, if you want. Go ahead.
Two years.
There we go. We can hear
sure,
you.
happy to. Like Brian mentioned, family medicine trained and preventive medicine trained here with the EIS program for 2 years and joining today. Thanks for having me.
Lauren,
Great.
you were really breaking up. We didn't hear that. I think must have been a bandwidth issue, but if you want to start over, sorry.
I'll try again. Sorry,
It's not working. Sorry.
Yeah, you know, Lauren, we'll catch you.
Reception, but I'm in the EAS program, but previously, okay, I'll put it in the chat.
Okay, thank you. That would be great. Name and email address if you could. Good to have you on. Robin, did I see you on as well?
Yeah, I joined.
All right, thank you, Robin. Is Matt on yet? Who else do we have on from DHHS that I'm not seeing?
Hey, Karen, Sadie's on.
Hey, Sadie. Good. Thanks for being on. Ishrat, I'm so glad you're on. Thank you for being here today. We don't have Matt yet. We might just hold off for him. If he's not, would you be so willing to step in for him if need be?
Yes, sure. Thank you.
Thank you. Thank you. All right. And I see here that Paulette is noting that he or she is retiring in September. Are you really, Paulette? After 46 years, very nice, very good. And we wish you the best in retirement. And we see you do have a replacement. And that's awesome to know. I just lost that chat. So let me try to bring it up again. You said your replacement was Renee. So we will make sure we get her on the books. And thank you for sharing that. Just as a reminder, please everyone fill in to the chat box your full name and the facility in which you are from. So Lauren, I do see your chat. That's awesome that you're here with us today. Okay. Let me go ahead and get started. On behalf of our DHHS partners, I would like to remind everyone that if you ever have a kind of unusual request from one of the doctors, if you feel this is something that literally needs to be sent to DHHS or possibly even CDC, make sure that you speak first to your local health department and that you get the proper approvals. As a suggestion, one of the things that came in this week that they got approval from CDC was hantavirus. So something unusual in our state. If that does happen to your laboratory and your physician asks that it be sent in, do remind him that it does need the proper okay and approval from the local health department, possibly even it should get to the state then. And the state epi people can walk you through the appropriate paperwork that is required. There may even be some CDC information that is needed or approvals from the CDC itself that is required. So please look up the appropriate people before you just send it to the MPHL laboratory and to send onward. With that, I'm going to go on and see if Matt is on yet. All right. Maybe we'll just kind of hold off on Matt and some of the reporting from DHHS. John, would you do the honors of filling in as far as updates on the sequencing criteria that we've been talking about getting out?
There we go. I think I got the mute button there.
Yeah, we can hear you.
Oh, okay, good. So as we've been going forward with a lot of the COVID-19 work, most recently, obviously, we've turned to sequencing and trying to get a better idea of what's going on as far as what's circulating in the population right now. Additionally, what we're seeing as far as clustering events and to a lesser extent how that's influencing vaccine breakthroughs. However, over the last couple of weeks, we found that we are generally statewide seeing more positive cases than could be sequenced in a given week. So with the help of Brian Buss, with the help of Matt Donahue, with the help of CHI and the College of Public Health, we're going to be sitting down and trying to figure out exactly which specimens, broadly speaking, we're going to be starting to prioritize for sequencing. We don't have an exact, we don't have any exact definitions for which ones will be prioritized, but my guess is that we're going to be shifting a little bit more toward a broader geographic range of specimens, trying to give more focus out to some of the rural areas, or I hate using the term, but trying to set some quotas in each run for rural specimens, trying to give a little bit of preference to populations that could be unvaccinated. But as we start to finalize these guidelines for which ones will be done, which ones will be sequenced, that will of course be communicated out. At the moment, there should be no change in how all of you are requesting sequencing or sending them in. Just keep in mind that we are getting more specimens than we can in any one day to sequence. So it's entirely possible that we will not get to sequencing specific specimens. If you have questions of why your specific specimen wasn't sequenced, please work with your local health department. They might be able to give me a little bit of context as to why it's an interesting case, why we really need to get it sequenced. But again, moving forward, there's going to be a little bit of rationing as far as what's able to be done on the sequencer in a given week. So no changes right now, but expect them coming down the pike before too long.
Certainly, John, thank you for that message. Things do change frequently, so just good to get that information out. And we will be putting further alerts, lab alerts out to let everyone know. So when we can, understandable. So I assume we're still seeing the Delta virus as a good percentage of our numbers.
Correct.
Yes.
Correct. Yeah, Delta variant remains predominant strain in the specimens that we are sequencing right now and being seen throughout the state. While NPHL specifically has been oversampling for specimens that we thought were likely to be Delta, I mean, at this point in the game, it's for lack of a better way to describe it, it's everywhere. I don't think that there are any geographic locations, any populations that it is somehow not circulating at least near. So yes, at this point, assume that everything is Delta.
Wow. All right. Do we know if we have had a uptick in vaccinations, and who might be working with that particular area? Maybe nobody on this call, but wondered if somebody would know. All right, well,
Karen,
go
this
ahead.
is
Hi, Brian.
this is Brian. Tracks all the the immunization program, and I have not had to be able to answer that question to say, you know, if we're seeing a change in the trajectory for vaccinations lately. But I can, you know, I can pass that on to the immunization program that there's some interest in looking at that. So, but
right.
we don't have that data readily available right now to share on this call.
Okay, that's fine. I have to share with you that in case we're having any problems, I know some of you have had iffy reception. It may be on my side. I haven't had any problem all week until just now. And it's telling me that my reception is kind of unstable. So hopefully we'll hang in there through this particular meeting. So I do have one question from Elizabeth. Let me make sure I've got it. So if not able to perform tests on everybody, should requirements to send them all, has it changed? Is that requirement changed? And let's see what her, because of what has been sent out, all admitted COVID patients and vaccinated. So yes, this has changed. Again, as John had commented, because of the capacity that we have at NPHL, unfortunately, our systems only hold a very limited amount of specimens, and it's to the fullest that we can hold, but it would, it does require quite a long run time, and therefore we cannot get everybody on at this point.
Karen, I can help you out there.
Okay.
This is Emily from NPHL, everyone. Please
Hi.
continue to send in all of those specimens. As Karen said, we are reaching capacity, but a couple months ago, we knew that this was going to be a situation. We anticipated this spike, as I believe everyone else on this call likely did as well. And we actually went about purchasing another instrument. These instruments are very large, and they have, as you can imagine, quite the back order, as with every instrument that has this capability in the nation. But we do have one, it's coming in. We are actually having to do construction on laboratory areas in order to get it in, but we are making that happen so that we can adjust our throughput to meet the needs. Now, with that being said, there is still going to be more positives than capability of throughput. The assay takes about 20 hours to run, and we can do 32 per run. We are having multiple instruments. That is what we are working on right now. But anything that doesn't go on the instrument, we are freezing down so that as things continue, hopefully continue to slow down or will eventually slow down, we can fill in runs. But as John said before, we're working with individuals to try to prioritize those that are of interest. We definitely want to get a geographic spread across the state because, you know, the state of Nebraska, a lot of the research done is Omaha heavy or Lincoln heavy, very population dense areas, but we need to be cognizant of everything that's going along throughout the entire state. We also pair with the CDC for submission of specimens as well. So if we can't sequence them here in-house, we ship out to the CDC as well. So there's multiple avenues to attempt to do surveillance for these variants across the state. So please continue to send them in. We may not get to them right away, but we will either work with the CDC to get them done, or we will go ahead and freeze them and get to them as soon as possible. But we are doing everything we can on our end to increase that throughput.
Yes, yes. Thank you, Emily. I'm glad you're on. We do have another question, if I may, and that was from Dan in David City. So I hope you don't mind me saying this out loud, but he does have some reagent shortages and wants to know if we could help. And certainly we'll go ahead, Dan, and get back with you and see what we can do to help with your testing needs, or if there's anything else that can be done. So Dan, thank you for alerting us. Are there, which brings me to ask really, are there any other reagent shortages across the state for COVID testing? Feel free to unmute or put in the chat box.
I don't know. This is Gerald from Syracuse. I think the coags maybe are still, we're so far ahead from last year on our NPs and BTMs. We've been able to get viral transport media in way easier. And then our manufacturer, at least on the COVID test, there's been no limits. I've been able to get as many kits as I want. So through our suppliers, so I don't know.
Okay, that's good. Zoanne Brosh comes with a question, or actually a comment that says they're having issues getting the BD Veritor COVID antigen test kits. So there's another situation out there. And
well, I could see that one too, that BD Veritor. You're competing against a lot of hands with all the urgent cares. So that I could see that one really being a lot of pressure because there's a lot of people that can touch that kit.
Sure. Sure.
As I
Um,
recall that the Veritor was one of the CMS. The Veritor was one of the CMS devices sent out. I assume that there's still a number of facilities running that test, long-term care facilities running that and trying to get reagents for it.
Okay. Julie also comments that Abbott Now ID Now, so it would be the Abbott ID Now COVID assays are starting to be on back order. And Tony, I think you can verify that we no longer offer those through the state. Is that correct?
That is correct. And what's getting tricky as you guys are talking about all the allocations is travel.
Hmm.
I literally just got off the phone with a call about travel and how fast they can get results, and they don't have enough reagent that they want to be using theirs for travel.
Hmm. Okay. Well, keep us posted. Dan says that they can only get 60 tests from Cepheid per month. That probably doesn't really handle it, does it, Dan? Unfortunately. Okay. Beth Paschal also says the same, that the ID Now kits are back ordered for them as well. So
Dan, are you looking at the singleplex COVID or are you doing the quadruplex for the Cepheid tests? And is there potential of validating both assays so that you have the different platforms to choose from? So, well, I guess it's the same platform, but at least the two different catalog numbers so that you can potentially meet the need across two different kits.
Yeah, we're doing both single and the fourplex, but they're still limited me to 60 of either one a month. I'm hoping to get both, but I haven't heard back from them yet.
okay. All right.
We're experiencing the same thing in Crete where we're allocated 100 and it can be whatever mixture of either fourplex or single COVID that we want, basically. We've done mostly the COVID only over the summer months, although we used more of the fourplex than we had anticipated due to the rise in RSV. But at one point in time, we had about a reserve of about 300 tests and just sitting on the shelf, and now we're down to 50. So in the last 2 weeks, we burned through almost all of it.
Wow. All right. Zoanne shares that her biggest issue is just getting reimbursed from insurance for the BioFire rapid panels. And that's understandable because that is by far a very expensive test. Wow. And I don't know if anybody really has a suggestion there. That would have to probably come from your hospital people to help you there. But good to know. I assume that physicians are well aware of that when they order it. I hope they speak to their patients regarding the cost of that panel. It makes a world of difference. So, all right, let's go ahead and move on then. Since I haven't heard from Matt, Ishrad, would you be so willing just to say a word or two about the breakout infections or breakthrough infections, as they call it, and what can you help and share with us on that?
So yeah, thank you, Karen. So breakthrough infections, I mean, I see that you had reinfections and breakthrough, but I just want to let you know that reinfection is down, but for breakthrough infections, definitely all our breakthrough infections are Delta variant right now.
Okay.
And we have seen an increase with the breakthrough infections, just like with our positive cases. So the scaling is the same, as the cases are going up, the vaccine breakthroughs are going up too. We are involved, we are sharing this data with CDC. One of the things that I can say that we are not seeing as much hospitalization or death with the people who have been vaccinated. So even though they are getting the breakthrough vaccination, COVID infections, the vaccine is working in terms of protecting people from, severe outcome. As for changes, we are seeing long-term care facilities picking up again. Most of them are vaccine breakthroughs there too. And we were sequencing, but now that we have so many facilities having positive cases at the same time, we have cut down our sequencing request. So moving forward, you're just going to see we are only going to request sequencing for those facilities where they are having at least 3 positive vaccinated residents turning out to be positive in the same week. So if we see vaccinated residents or a staff becoming positive here and there, we're not going to ask you to sequence. You're just going to do the, NPH will be involved in confirmatory PCR, but we don't need to sequence them just because, it might be Delta. But if we see that there's a cluster of several people and the population is very, very vulnerable, we may request you to sequence them. So we are having a threshold now and doing very targeted.
Very good to know. So, yeah. All right. Any questions for any of our DHH staff? Meanwhile, and thank you for all your comments in the chat box. Good to know about the reagent shortages or kit shortages. Any questions for us? All right.
Karen, I just want to interrupt real quick, if you don't mind.
No,
I know you
please.
guys said that there was a shortage on the ID Now, the stuff that I realized those are molecular-based assays, and also the BD Veritor. Would there be any interest at all in Binax Now test kits? If so, if you could just go ahead and chat me directly in the box, I may be able to see if we can push forward a group allocation or something like that through federal partners, but I need to know if there was interest, and I don't know for sure if it can happen, but we can always try to do anything we can to support testing across the state.
Okay.
Emily, I have a comment about that one quickly. I think Douglas County is getting a lot of requests from long-term care facility for about that Binax card. And then they were long-term care facilities were trying to order it from the company, but there is no supply. So that's an update that I have on that.
That's probably good to know, but on the other hand, Emily, don't our federal partners sometimes come in helpful when the actual commercial companies may not be as helpful?
Yes, they absolutely do. So thank you for that, Ishrat. I can, like I said, attempt to reach out to our federal partners. I know it's been a topic of conversation lately, and I'll do the best that I can.
And I think the person that reached out about that is Dr. Ann O'Keefe from Douglas County.
Okay. Yes, thank you. Thank you. All right. Well, with that, I'm going to go ahead and move on. Would like to know if Sadie or Brianna want to share just a quick update on anything else besides COVID going on in the state. I'm sure it's not the only thing nowadays.
Hi, Karen, it's Brianna. So since our last call in July, We have 16 more cyclospora cases reported since our last call. So that's putting us at 26 cases so far this year. We haven't had a new case reported since last Wednesday, but I don't know, we'll see. CDC and FDA are investigating 2 different clusters of illness right now with cyclospora. So, you know, they're gathering that information from epi interviews. So I'm just trying to work hard to get all of our cases interviewed and get that data to CDC so they can analyze it. And yeah, I think that's all I was going to mention about cyclospora. Hoping, you know, typically I'm just looking at last year, we had a large outbreak last year, but typically they start dying off at the end of August. So I'm ready for that.
Yeah, for sure. For sure. And do our laboratories all know how to order for the cyclosporas? If you have a physician that comes to you and asks how to order, do you have the testing ability to do it? Just I want you to look into that. If not, please contact us to see what we can do to help. But again, if you have a possibility, you need to talk to your local health departments as well. Go ahead.
Yeah, I'd say the most common is probably the GI panel, the BioFire GI panel, how it's detected, but also some labs I know do the modified acid fasting. So
yes, it's pretty rare tests that people do, but some of them did bring that test up here a number of years ago and had to rely on that. It's not an easy test, so maybe worth reviewing.
And then I think Sadie was just going to mention a couple clusters or outbreaks that CDC is also managing, different than cyclospora.
Thank you, Brianna.
Yeah, I just wanted to touch on Salmonella and Shiga toxin E. coli multi-state outbreaks. So right now we have 4 open CDC multi-state outbreaks. One is the Salmonella backyard live poultry outbreak. We are a part of this every single year, and I can link that in the comments. And then we're also a part of a Shiga toxin E. coli outbreak that was 0121 serotype that was linked to cake mix, and I'll also put that in the chat. And then we also have just 2 like clusters right now going on. They're still in the hypothesis generating stage, so we'll see what comes out of that. But as far as like overall cases for Salmonella and Shiga toxin E. coli, we are actually down with COVID. Last year, we actually saw about a 25% decrease. And similarly, this year, we're about at 2020, maybe a little bit higher, but we're still much lower than our pre-pandemic levels, probably due to non-pharmaceutical interventions, as well as, you know, last year, like pools were closed, childcare, daycare facilities, you know, all of those kinds of things. So yeah, that's all I really have. But I do want to touch on, I know since a lot of facilities have started using the GI panel, it can be difficult to follow the process of sending reportable specimens to NPHL, and maybe just revisit that process. Maybe every shift change, just go through and see if any stool specimens were positive for a reportable that need to be sent to NPHL. I wish we could share more of this information with you, but if it goes to NPHL, it will be sequenced, and then we can link it to these multi-state outbreaks, and it's super helpful information. So please send them. Let me know if you need help with that. But yeah, would love to have those specimens sent, or else I will call you, and you don't want me to call you. That's all I have to say.
Yeah, it's easier to dig the specimen out when you're testing it right in that run versus having to dig it out 2 days later and you've got hundreds of specimens to dig through. Don't want to do that, right? So I would recommend putting a big note up on your stool bench if you do that particular type of testing, and make it a note that if you have a positive, pull that specimen right away, right there, right then. So, and send it to NPHL. We would greatly appreciate it. So Sadie, thank you for sending those links on there. I will make sure then to share those links in an email after our meeting as well. So good to know. With that, I'll move on. Robin has let me know that she does not have audio. So unfortunately, I don't think we'll be able to touch on much about RSV. You are aware that she does have a weekly report on the RSVs. I have her down for speaking about influenza too, but that's been pretty minor. Emily, can you speak to that though? Have you had to do any testing at NPHL on influenza?
So I wanted to bring that up. There is some chatter going around the nation that flu is starting to pop up. We are seeing it on some PCR-based assays as opposed to antigens, which is highly likable to be confirmed. If anyone sees a flu pop up, please, please, please submit it to NPHL. We are not officially in flu season yet. And so anything that pops up right now, we do need to do testing on here at NPHL, as well as work to transfer it to the CDC for additional testing. And I did want to tell you all, Robin put a little note in the chat. She says that both negative and positive COVID tests continue to be reportable. Please keep reporting those to the state so that once again, that is positive and negatives. And she also wants to remind people to consider RSV and respiratory disease, especially in those individuals aged 0 to 4. As you all know, there is a large RSV outbreak going on right now. The numbers are soaring and we're not in the traditional RSV season yet. So this is potentially concerning. We've heard of hospitals across the state who do not have beds available anymore, potentially due to this RSV surge. So this is something we definitely need to keep an eye out for and watch. And then she wanted to reiterate in the note in the chat box as well about those positive influenza specimens to get them to NPHL. And one of the big notes in getting them to us is if there is travel or agricultural exposure. Of course, we want to know, was there swine exposure? Have you been traveling to the Southern Hemisphere? That kind of stuff. So we can always use NUALERT to send those flu specimens in.
Emily, thank you for bringing that note to our attention. Robin also shares that they have had 2 flu variants last week. Is that true as well?
It looks like that popped up in Wisconsin based on the chat box. She's just typing that out completely. But we have heard rumblings of positives, like I said, popping up. Some of them were, I know, confirmed seasonal, but obviously these variants are definitely of concern. So please, if you see anything, let us know. We don't know what to expect this upcoming respiratory season. We thought 2020 was the big questionable respiratory season, and now I think it's actually going to be 2021. So very interesting upcoming fall.
Sure. And forgive me, I read that as we, not Wisconsin. So all right, moving on. I didn't know if Derry or Dennis or Tammy or Kristen, if they're on to speak to their particular departments. Do we have any reports from them?
This is Kristen with the TB program. And I just wanted to remind everyone, as we're dominated by COVID-19 and the Delta variant, to please consider TB as an alternative diagnosis in these times. If you have a suspicion, please collect sputum. We may assist with a public health lab collecting samples. We have had cases here where people thought diagnosis was COVID and we got a late TB diagnosis, and this has been happening nationally as well. So for all the labs, just keep that in the back of your mind, as we are so heavily focused on COVID-19, which is rightfully so, but to also keep your, keep TB in the back of your mind as an alternative diagnosis. Our numbers were up last year in Nebraska. We had 36 cases, which was one of the few states that had an increase. Right now we're down, we're sitting at 9 cases as of today. So I'm assuming the mask wearing, lack of travel is part of that, but just to keep your eyes and ears out for TB as an alternative diagnosis. I prefer not to miss someone and have more exposure. So just to keep that in the back of your mind as you're caring for patients. That's all I have, Karen. Thank you.
All right. Kristen, I'm really glad you were on to share that with us. So, and as she said, if there's any question about TB, certainly it's something that we can help you with. We really would like all specimens that have TB or the possibility of having TB, have them come to NPHL, because we are part of a program with CDC for TB elimination, and that requires us to do TB genotyping. And so each specimen positive throughout the state, we really would like to be involved with your diagnosis and to get that isolate. So thank you. I think that we could go on. I know we've pretty much talked out the COVID. Emily, thank you for bringing that on. Brian Lenz, are you still with us, or Paul, to talk about any client service issues you would like to share with us?
This is Brian Lenz. I'm not aware of any client service issues at this point, so I'll default to Paul.
Okay.
And possibly Tony. And if Jessica's on, I'm not sure.
All right.
Just real quickly, COVID questions. We had one potential miss or use or inappropriate use of public health account for COVID testing that Dana and I are following up with Bellevue University later this week. Allergy and asthma clinic. Thought they were doing a good service by swabbing some athletic teams. So we'll be following up with them, and maybe that's not how they should be using state resources. And then we had a couple, Tony was able to talk with a couple of clients, Jefferson County Hospital and Fairbury Clinic, I believe, about making sure they have the appropriate requisitions and the appropriate orders accompanying the samples when they're coming in, not green sticky notes with scribbles. So those are only two things, but they seem addressed. Everything else is humming right along over here in the doctor's building. So keep on sending them over.
John was amazing in helping sort through all these things. And thank you so much for all that and your time, John. I appreciate it.
Say, Paul, this is Pete. Our volumes have increased about 3 times in the last week and what they were. Is client services prepared to have that steady increase in volumes for COVID testing?
The surge room is well equipped and well staffed. I'm a little anxious about the fall schedule change with students.
We all are, yes.
So that is one hesitancy we have, but I'm working through that now. The collection site should be okay. We have 2 full-time employees here, the 7 days a week, so that shouldn't be an issue. But the surge room, most of the volume is after 9 p.m. So Vincent and Ian have been handling that, and I have not heard that their schedules will be affected. The morning ones, where we have those last couple, 20 or 30, that Nithya, Josh, and Kelsey have been working on, I am a little anxious, but I am confident we'll find coverage and make sure that the samples are ready for the 8 o'clock run.
Sounds good, Paul. And if we hear anything in the public health lab about a big push to do some testing, we'll get you as much information as we can early. I know there's some issues about testing at some of the universities, so we'll let you know.
Sounds very good.
Thank you, Paul. Only one more thing I'd like to bring up with client services, and I believe I see this only on the NPHL side because we handle shipping so much. One issue we've had is our address. So I fear that there are quite a few old NPHL requisitions floating around out in our laboratories. The old NPHL laboratory requisitions had an old address on it, had what we would call our campus address, which is it isn't a physical street address. It is something that starts with 991180 or 985900. And it is, and it says 981180 Nebraska Medical Center. The problem with that is, as I say, just a campus, all campus address. It is not specific to what loading dock they should use. And it has become a huge issue right now because there are 3 loading docks and on the campus. Actually, there are more, but we've had problems with them being delivered to other loading docks because our FedEx and guys do not know where this particular address is. So they deliver it to the wrong dock. It is, and unfortunately, if it gets on the wrong dock, we don't get the specimen right away. It might sit there for a half a day before somebody actually finds it. So my point is we can no longer use that address. I believe that sometimes there are stickers that client services has that you can put on the box that has that, and we will no longer accept that sticker. It has to be, if you go on to our NPHL website, find under forms, under the tab called forms, there is an NPHL requisition with the actual shipping address. It's a physical address which is needed in order to ship all specimens. So please, please, please help us get those specimens to the laboratory. It needs to go on a timely basis. Please use our correct address. I just wanted to also point out that New Alert, if anybody needs a review as far as how to collect specimens, to enter it into our New Alert system, which we would much prefer over paperwork. A manual paperwork is okay if you're only sending a specimen once to us, but if you're sending it multiple times, we would certainly prefer that it be put into the NPHL system called New Alert. I would be happy to help you get an account to bring that system up if you currently aren't there, and then also to set up a courier for you. If you're in one of the greater Nebraska laboratory sites that don't have an NPHL courier, we could get you set up with either FedEx or UPS shipping. That will assure us that those specimens get to us on a timely basis. So thank you to all the chatter going on the chat. I don't think I'll go through it, but for recording purposes, those are the staff who were not be able to hop on right now. They might want to be listening to this, and there is some chatter about, let me go back. Not only Sadie sending those. Yeah, Emily really points out that we would prefer a nasopharyngeal swab for influenza samples as well as COVID, but we do accept those nasal swabs, but you do need to transfer them in what we call the VTM or UTM, which is the universal transport media. And do need to follow general respiratory specimen guidelines, submission guidelines, try to get them into NPHL as soon as possible. If that cannot happen, then maybe it can be refrigerated even up to 72 hours. If you cannot get it to us before then you'll have to freeze the specimen, but then think forward that if you freeze a specimen, once you freeze it, you're going to have to ship it with dry ice. If you have access to dry ice, great, then send it that way. Make sure you use the proper shipping labels for dry ice. However, if you do not have access to dry ice, you're going to have to do everything you can, and we'll help you. Just let us know, get that specimen to us as soon as possible. Gerald did share that they are narrowing their specimen shipments to just those that are vaccinated and hospital admitted. I think that's what you're asking, is if you should. And I believe John addressed that there on the chat box. So we have a couple of more questions. Shannon, I know I had a question about sending hospitalized COVIDs positive. If they're discharged, should you send them? Did we get an answer to his question? And John does say that, no, that's not necessary. So good to know. Dan, you do use OnTrack. OnTrack is fine. They can get it to us within a number of hours. The thing to remember with OnTrack is they are not exclusive. So you cannot send just a bio bag and give it to them. It has to be in a category B box. So if you need those category B boxes, we can help you with that and get you a supply of those. And we just turn around and reuse them. It has pre-labeled addresses on them. You'll get them back and it can be used again. The only time we throw them out is if they're damaged in shipment, and we'll just replace them with new ones. So I think with the time growing short, we're gonna skip biosafety. It just was kind of curious how laboratories are handling their COVIDs now. If you've changed your process, that's something that if you have any questions about, certainly forward those questions to us. We will help you with the biosafety concerns that you may have. Last but not least, I wanted to also bring to everyone's attention, not just if you have a microbiology lab, but anybody who has an interest in the bioterrorism, or what we would call laboratory readiness. It is a laboratory preparedness response. And it is the rule out and refer process. The CDC asked all laboratories to be familiar with it, especially the labs that do any amount of microbiology. Even if all you do is gram stains on blood cultures, it's important that you recognize certain bacteria, especially anthrax. But also we want you to be aware of the gram-negative coccobacilli that can be hazardous as well. And we have had some very interesting cases in the surrounding states to Nebraska. We have seen an uptick in some Burkholdeриas that we want all of our microbiology laboratories to be very aware of and prepared for. With that preparedness, we are having a course that's open to all on September 7th, but it is a very long one. I'm holding it from noon to 3 p.m. This is taking place of our full day classroom that we tend to have here. And it is primarily going to be interactive. So if you are registering, there will be an assignment that will be due before class, and also there will be some interaction. So I'm hoping you have the type of computer and a computer setup where you have a webcam, can speak, because we will ask questions and ask you to participate in case studies. After that training, we hope to send out our challenge set and to remind everyone, LPX, if you're enrolled in LPX, that will be out in September after Labor Day. By October, we hope to do one more gram stain challenge set for laboratories that only do gram stains. And in November, we may break it open if I can really get to it this year. The the topic of chemical terrorism. It will be just a online training with chemical terrorism, but it's something we haven't handled for 5-6 years. And I'd really like to touch base with that. So that's what's out there for training. If that is not something that works in your laboratory, there is a number of other trainings available. If I can get back to my agenda, at the bottom of my agenda are some online trainings that you can participate in. There is a packaging and shipping training available. There is also a virtual LRN training, just basic microbiology steps, how to do a catalase, how to do an oxidase. So it's virtual reality. You might look into that. I do think that they will provide you a VR glasses, but don't quote me by that. I do know those are being made available. And I believe there was one more training in here, the fundamentals of personal protective equipment in the laboratory.
Thank you for choosing us for your healthcare requisites. Please stay on the phone. We will be right with you.
I have somebody that put me on hold, but we will try to work with that. Anyway, does anybody have questions on training that I can help with?
We value your time. Thanks for holding. We will be with
I
you
will try
momentarily.
to get that muted here quickly. All right. I hear no questions. Does anybody see anything in the chat box?
We are dedicated to providing quality, professional, personalized care to our.
There we go. We got that muted. Thank you. Derry Stover, I see you on at the last minute. Would you have any lead updates for us?
No, not at this time.
Okay.
Maybe would probably be looking at some data next call.
Okay, that's fine. We look forward to hearing from you. Okay, with that, I think we've got maybe only 2 more minutes, but we'll go ahead unless somebody has a burning question. We will go ahead and sign off from Valentine, Nebraska. And good to talk to you all. I'll be back in the office by next Thursday, but don't hesitate to send emails or texts or questions that you might all have. Thank you very, very much. Goodbye now.
Thanks, Karen.
Thank you, Pete. Take care.
Yeah.
Bye, Emily.